Utah politics.
Thanks so much for joining us. I'm Glenn Mills. It is time to go inside Utah politics. We do begin this morning with Brandon Kalor. He is with the American Foundation for Suicide Prevention, here to discuss the launch of 988. Brandon, great to have you on the show. Thanks so much for being here.
Thank you for having me.
Let's start off with the Suicide Prevention Lifeline. Just give us an idea of what it's all about.
I think it's wonderful. Senator Dan Thatcher of West Valley, many years ago, 2014 to be exact, started this campaign to get a lifeline here in Utah, a 3-digit number that would make it easy for folks to get a hold of the crisis center. It didn't pass that year, but it led the way to Safe UT, which is very similar to 988, whereas it gave callers an opportunity to reach the crisis line, the lifeline, very simply with the press of a button on their phone, on their app. A few years later, Senator Orrin Hatch and Representative
Chris Stewart.
Thank you. Representative Chris Stewart took that to the national stage, and they were able to pass the lifeline and the number 988 with the help of the FCC, the Department of Veteran Affairs. They were able to establish and designate that number 988.
And really the idea is the 3-digit number is it's like an emergency, just like 911. During an emergency, a physical emergency, this would be a mental health emergency, something easy to understand and that will be answered when people call. Talk about the importance of that, just having something that everyone knows what it is and someone will always be on the other end of that call.
That is so important. When you're in a crisis, it would be very difficult to remember that 10-digit number. So the number 988 will be a much simpler way to access that crisis lifeline.
And when someone answers on the other call, talk about how crucial it is to get an answer right at that very moment.
Well, the goal is to answer those phone calls within 3 minutes because it is very, very critical that time. And we know that about 90% of those calls can be de-escalated and those people can be helped with just that simple phone call. And it's very important to understand that we need more. We need more advocacy and more funding to beef up the system. Our infrastructure needs responders to go to that person if that crisis can't be resolved on the telephone. We need mobile crisis outreach teams that can go and help those people, just like EMS when you call 911.
And that's something we've seen implemented here in the state of Utah as well. What can you tell us about the launch? This happened last weekend. What have you heard about how it has gone over?
It's going very well. It's going as expected. We saw at least a 50% increase in calls to that line. I think a lot of those callers were just testing the number, but it goes in line with some of the other launches, like I mentioned the Safe UT app. We also saw an increase of about 60% rate because it's just so simple to get a hold of those crisis intervention workers.
Talk about suicide here in Utah. I know it's had a really big impact on many lives, whether directly or indirectly here in our state.
It is, well, let me go back a few years before the pandemic. So if you look at 2019, we were about 6th in the nation for our suicide rate. Today, we are 9th. So we're seeing an improvement, but there's still room for improvement.
And among young people, it's a really sad statistic that it's the #1 cause of death here in our state.
It is. It is still #1 for that. If you look at 10 to 24 years of age, it is still the #1 cause of death.
What impact can this 988 number have on the issue here in the state of Utah?
It'll get people connected to the right people. It'll get them connected to those professionals that are ready to help in a crisis.
So when you talk about how we've been able to improve here in the state of Utah, do you see this as being another crucial element to improve that even more?
Absolutely. And I'd like to point out, though, there's still more work to do. Speaking of those MCOTs, those mobile crisis outreach teams and receiving centers, we need more funding so that we can have a more robust infrastructure. So that as people continue to call, because it is going to be easier to call, they need to have those calls answered.
So what will that take Brandon, to make sure that happens in the coming years?
It'll take legislation. We need to work with our champions, like Senator Thatcher and Representative Ellison, have been some champions for mental health, and there's been many other legislators. And it takes all of us. If we want to get involved, we can go to afsp.org, and you can be an advocate. You can reach out to your legislators. You can discover who your legislator is if you're not aware, and you can reach out to them and have those conversations.
Yeah, your organization does a lot of great work up on the Hill. I know I've been there on advocacy days, and it does draw people from all over the state. A lot of times people have a personal motivation for being involved. I know that's the case for you as well. Can you share your story with us?
I will. Professionally, I've been involved in suicide prevention research for a very long time. More recently, my family experienced a tragedy, several tragedies, and I became more personally involved. And so I went from research, suicide prevention researcher, to advocate. And I joined the American Foundation for Suicide Prevention, and I'm now a co-chair of the Public Policy Committee. And it helps me feel like that loss that my family experienced is giving me is driving me to a purpose.
And do you also find a support group, so to speak, in the people that you work with when it comes to coping with that loss?
Absolutely. We all share some similar stories, and we can help each other through that.
Okay. Again, you already mentioned this, but I want to let our viewers at home know how they can reach out and get involved and connect with you guys and make a difference in this area. If you could just go over that one more time, please.
Absolutely. afsp.org, and you can become an advocate, a field advocate.
Okay. Very simple. Brandon, sometimes a tough conversation, but very important one to have, and looking forward to seeing how this new Suicide Prevention Lifeline can make an impact on this issue. Thanks so much for your time this morning. Really appreciate it.
Thank you for having me.
You bet. Still to come, congressional Democrats pushing a bill